Hi, everyone. I'm Solome Tibabu, the host of Going Digital Behavioral Health Tech. We have a really great conversation today with Dr. Rowe from Vida Health. Before we get started, Dr. Rowe, could you just do a brief introduction about yourself and maybe what is Vida for those who might be unfamiliar?
Yes, thank you for having me. My name is Christy Vo. I am Vice President and Head of Psychiatry at Vida Health. And Vida Health is a virtual first chronic care solution that is targeting toward treating the body and mind together for chronic physical and mental health conditions.
Thanks so much, Dr. Vo. So you've had some pretty big announcements recently, one of them being around prescribing. Can you walk us through what that looks like for Vida members?
Yes. Vida recently announced that we're rolling out prescribing services, and that is across all of our programs that impacts physical and mental health conditions. And we're going to start as soon as July for our existing clients.
Amazing. And just to clarify, what do you mean by prescribing?
So prescribing at Vida is a tool that can augment the care that a patient receives to improve their overall mental and physical wellness. We use personalized medication management based on standard of care as well as best practices. And it could mean you initiate a medication. It could also mean deprescribing, meaning taking the patient off a medication or reducing the dose. And that just helps us provide a comprehensive, individualized treatment plan for the patient based on their needs and clinically appropriate.
Thanks so much, Dr. Vo. And I know that one of the major themes at Vida is the idea of integrated physical and behavioral health. Can you talk a little bit about how prescribing improves integrated care delivery for chronic physical and mental health conditions?
Yes. So when I think about integrated care, I think of the collaborative care model that is very evidence-based on the University of Washington Ames model. And that is when a psychiatric prescriber works with the primary care team, as well as work with a behavioral health team, such as coaches and therapists. And when we do that at Vida, we do have those components. We're blessed that we have therapists and coaches, and our technology is built in such a way where we empower our clinician to better engage with each other and to better coordinate care with each other more effectively. So I like to point out that at Vida, we built technology that really makes our provider superhuman so that they can really deliver care, best quality care without worrying about all the inefficiency that comes along with technology.
Excellent. Thanks so much. And, some folks might be wondering what guides your prescribing. Can you talk a little bit about what are Vida's care principles and how do your prescribing methods reinforce them?
Yes. So one of Vida's care principles is that we apply technology to help our provider and patient engage together in personalized care. And this ties back to the previous question. So as mentioned, we believe that Vida, it's about using the right provider, at the right time, delivering the right level of care for that patient, mental health needs or physical health needs. And when we do that, we are providing a full spectrum of care. And prescribing is just that one missing piece that we were missing until now that we didn't have. And so prescribing really complete picture of all the services that we can provide, such as coaching, therapy, and now prescribing.
Excellent. So you take a really expansive view on prescribing, but can you talk about why psychiatry is one of the first items Vida is focusing on when it comes to prescribing?
Yes. So psychiatry is, in terms of prescribing for psychiatry, it's not being added because it's a silver bullet that solves all of the issues of mental health. Mental health is a complex system, and we all know that. And we have also gotten great results in terms of mental health outcomes from our therapists and coaches alone. So we were adding prescribing because this is the next best step to build a member-centric, comprehensive treatment plan for our members. And that makes our care environment, which is the environment within Vida, be more robust and member-centric.
And one thing I also am familiar of Vida's work is your cognitive behavioral therapy-based mental health care model. Can you talk about how prescribing fits into that practice?
So our CPT program is delivering the gold standard of care across our mental health programs, as well as our coaching programs. And CPT works for those who it works for, and it's been evidence-based for all sorts of condition. However, sometimes there are people who need it more than CBT. And so prescribing comes in so to really add on to those who needs more. Studies have shown that combination of medication and CBT and behavioral change really do help a selected group of people. And because we add that to, we can cover more severity and more spectrum of care for patients on more severe spectrum.
Thanks so much. That was really helpful. Is the prescribing population specific or available across all levels of acuity?
So in general, psychiatric prescribing is often looked at as a tool to help with moderate and severe anxiety and depression. Here at Vida, we're actually triaging the needs of the patient based on evidence-based metric. And that metric is collected from the patient. And it's also, we're also working in tandem with the 3 different providers we mentioned, like the coach, the therapist, the prescriber, to come together and look at the patient metrics, look at how the patient is doing, and determine if prescribing is going to be an effective part of the patient care or not. So while we are a tech-based company with many technology efficiency, we also rely on our provider discussing the patient and coming up with a treatment plan that is best for their care path. And Vida uses a flexible approach rather than a rigid one. A lot of other digital health companies are very regimented in their protocols. And for us, while we have a standard protocol and procedures, we have a flexible approach because we understand that mental health is complex. And there are always these outliers, right? That doesn't really fit in the box. And we want to be able to care for everybody, regardless of they are the stereotypical depression or the stereotypical anxiety or not.
That makes a lot of sense. And I know we've talked about Vida's technical capabilities at different Going Digital events, but excited to hear that you really take a holistic approach. It depends on, again, what the patient needs, what the member needs rather, and your providers are really tailoring their care toward whatever the situation might be. Can you tell us maybe more about your escalation process? Is prescribing part of an escalation process, or is it more of a standard of care, if you will?
Yes. So prescribing for us is not a standard of care. It's part of an escalation process, but it's also part of a de-escalation process. So not everyone that comes to Vida is going to be clinically appropriate to recommend prescribing. So we would only recommend prescribing when it's clinically appropriate. And, on some cases, even if it's clinical appropriate, some patients are not willing, right? They're not at that phase in their life yet. So we're member-centric. So we work with the patient where they are at in their life and what we can do to help them be functional and have good quality of life. So at Vida, the prescribing process is just one of many tools that our provider and members can leverage as they work together, the member and the provider, to determine the best care path for them.
Yeah, I think that's really important to point out. It's like over time, folks are going to improve. So what's the plan to de-escalate? That makes a lot of sense.
Actually, I'd like to talk a little bit more about the de-escalation part. So when a patient gets on to the path of prescribing, oftentimes just as a regular in physical clinic, there are times when a patient gets stable on a medication and can be taken off or taper off the medication, or they are doing so well that they don't have to see us as frequent, right? So the escalation process is when we could potentially take off the patient off the medication or de-escalate them in terms of severity, where if they're stable, we take them back to perhaps coaching or perhaps therapy, where a prescriber is not necessarily needed in their care.
Right. I feel like we talk a lot about how digital health companies are triaging members to the right place, but this idea of re-triaging when appropriate and continuing that monitoring to make sure they're always getting the right level of care. I don't hear that much, so that's good to know.
I like your term, re-triaging, because exactly, yes, we re-triage at many points in the patient care path.
Yeah. And speaking of patient care path, so I just have to ask, as a psychiatrist at Vida, how do you think about prescribing options fitting into really an overall personalized care plan for each member?
So because we are expanding the service we provide to our patient by offering this prescribing service, it makes it full spectrum. And so that they don't need to leave our ecosystem. When I say they don't need to leave our ecosystem, you can relate to the fact that when you try to find a therapist or a psychiatrist, it's often not within a patient medical home. It's not often within the same context as getting your medication for hypertension or diabetes. So our aim is to really deliver the mental health needs and the physical needs within the Vida user experience, all within that user experience. So that patient doesn't feel like they are going all in multiple different places to receive care with providers that aren't really talking to each other. Currently, healthcare is very disjointed and siloed. And I think that's part of the problem that, that should be fixed so that we can improve mental health outcomes and physical health outcomes. And so if you were to take just one point from this conversation that we're having, is that at Vida, we aim to offer full care, spectrum of care that deliver the right level of care to all of our patients across the severity spectrum at the appropriate time with the appropriate provider.
Thanks so much. That's really helpful to understand. But I know we've been talking about prescribers generally. What types of prescribers are on your team at Vida?
So at Vida, we really believe that all providers should practice on the top of their license. That means as a psychiatrist, we are a subspecialty. And that means often a psychiatrist can work as a consultant level to primary care, or when it comes appropriate in terms of severity or the patient needs, a psychiatrist is being pulled in to manage the patient care as appropriate. So that means that I would be, and the psychiatrist would be working with primary care doctors as well as NPs in primary care, as well as NPs trained in behavioral health. So those are kind of four main type of provider we are planning to have. Psychiatrists, primary care doctors, NPs that are in primary care trained, and NPs that are in behavioral health trained. And as I mentioned before about how I'm hoping to build the collaborative care model with multiple disciplines in that model. It's based on the University of Washington Ames model, and it's very evidence-based. And as I am building those teams, those are the four components of provider that I'm looking for. And I hope that if any of you are listening and you're one of those providers, please reach out to us. And we're always looking for enthusiastic, passionate providers.
Thanks. That's quite a bit of folks internally. May I ask, how do you partner with outside entities?
So when it comes to outside entity, I think a digital health company in general should be aware of what they're good at, what their expertise lies, and where they could partner with other entity that has perhaps more specialized care. And so for us, if there are patients and members that have particular disease disorder or whether mental health or physical health that we think we're not at the time able to provide the most comprehensive care, we plan to partner with those niche digital health companies providing specialized care. And that partnership can look like a referral, a bidirectional referral pathway, or as our partnership developed, there could be different ways to partner. And so I'm always happy to chat as well to any digital health companies that provide specialized care. And it's always good to network and be acquainted with each other at the very least.
I'm so excited that we could share your announcement about Vida prescribing for our audience who's listening. Work with them, partner with them, lots of new opportunities for prescribers as well as discussed. And thank you so much, Dr. Vo, for sharing with us.
Thank you so much for having me. I appreciate it.